Hi, this is Michael and I'm a podiatrist at Harding Podiatry on the northern beaches of Sydney. Today, we're talking about children who develop bunions at an early age. We call these juvenile bunions. As a parent, should you be worried about this? Let's find out. Some of my patients come in calling the bunion a bone growth. That is not what a bunion is. A bunion is a rotation and the protrusion of the metatarsal bone, generally due to the excessive pressure on the joint. This can be common among adults due to years of neglect. But when it comes to children having bunions develop at such a young age, it's considered unusual. Some parents think bunions developed in children is caused by a child wearing inappropriate footwear, such as narrow or too tight footwear. This may exacerbate the issue, but not the case. Bunions are caused by a combination of factors, such as hypermobility, poor foot posture, most notably flat foot, or they can be hereditary, a trait passed down across generations. Because foot type is passed on through family at a genetic level, if we see bunions affecting the parents or grandparents, chances are the children or grandchildren would be predisposed to bunions as well. There are also more serious causes of juvenile bunions, such as juvenile rheumatoid arthritis, low muscle tone, or neuromuscular disorders. If your child appears to be developing juvenile bunions, look out for symptoms such as soreness, swelling, redness, aching, or sharp pain. The child may also complain that their relatively new shoes are getting tighter, but that is not likely to be a growth spurt, but it may be widening of the foot due to bunion development. If the child is not experiencing pain or discomfort, it may be asymptomatic and the bunion will exist as a visual deformity that may worsen as they get older. In such cases, the bunion will cause no problems to the child during their pediatric years, which can result in them being missed until a later stage. Discovering the cause of the condition plays a huge part in how to manage this progressive deformity. Early diagnosis is key to managing bunions without surgery. Non-surgical treatment options include foot custom orthotics, which work by reducing the load going through that big toe joint, pediatric ankle foot orthotics when there is severe deformity, footwear modifications due to rubbing of the bunion, and exercises aimed at controlling and gently guiding the growth. It's also important to get an X-ray to measure the angle of the deformity to monitor over the growing years of the child. This assists the podiatrist to determine if the treatment is managing the deformity or if further intervention is required. The more restricted the joint, the harder it is to address the deformity. If you have a family history of bunions or have concerns about your child who have what it looks like a bunion, do consider consulting a podiatrist, as early detection and treatment can make a big difference to your child's foot health. Thank you guys for tuning in, and I look forward to speaking to you soon.